Now that you know how to do the pelvic floor release breathing and the pelvic floor release with the towel, it's time to work directly on the pelvic floor through perineal massage. The perineal body, like I said before, is the center of the pelvic floor. It's a tough ligamentous tissue that is between the introitus or the vaginal opening and the anus. It's where a lot of the pelvic floor muscles join and is really important because it creates a stable base for the muscles to contract from. The purpose of perineal massage isn't necessarily to stretch the tissue out, but it is to help you assess your pain tolerance and to soften any tight tissue to prevent the tearing of this area. You're going to want to set yourself up in a comfortable position. You can do this in bed or in the bathtub, getting some blankets or some pillows and setting yourself up in more of a reclined, comfortable position. Now, to get into this position, what I want you to practice doing is inhaling to prepare, and then as you exhale, you're going to allow that connection, that shortening of the pelvic floor and the tummy muscles as you lean back. Okay, that's also going to help with how our pelvic floor responds during birth. This is a great setup for you to be able to reach the pelvic floor, the perineal body, but it's also a good position for you to be in if you ask your partner for help. Once in this position, you can place your legs in a butterfly position. You can also put blankets or pillows underneath your legs so that they are fully supported. You can also go into the legs up position to make space for the massaging. You also want to make sure that you have washed your hands and that you have cut any very long fingernails that may prevent you being able to get to the tissue very well. So once you've set yourself up and you've started with some pelvic floor release breathing just to start to calm yourself down, you would begin with using one finger. If you are doing the perineal massage yourself, the easiest finger to use is your thumb. If your partner is helping, you can use a pointer finger. I'm going to be doing it from you doing the perineal massage angle. So what you would start off with is imagining that the introitus or the opening of the vagina is a clock. The perineal body is 6 o'clock. On either side then is 5 and 7 o'clock. These are the two areas that we are going to focus on. So with your finger, and you may use some lubricant if you want to, you would place your finger right on the perineal body with the tip of your thumb at the opening of the vagina. From there, you would slowly insert your thumb. The easiest time to do this is with an inhale because, again, that's when these muscles are relaxing. Once you have started to insert the thumb, you're going to insert to about your knuckle. You then want to bring the thumb off to either 5 o'clock or 7 o'clock, so either side of 6 o'clock. Once you are at either 5 or 7 o'clock, you are going to then start to stretch the tissue outward towards your sit bone. You will do this until you feel a burning sensation. It has to be a tolerable sensation though, but it starts to get you to understand what your pain tolerance is. Then what you want to do is, using your pelvic floor release breathing, hold this stretch and see if the burning sensation goes away or how well you manage it. It may not go away. Once you've worked up to a minute of this hold, you then can move on to the other side. And you may need to switch thumbs so that it's easier for you to get to the opposite side. Once you have done 1 finger releases, then you can move on to 2 finger releases. So you would do the same exact stretch, but with 2 fingers at the same time. So now we are pulling away from each other towards the sit bones at the same exact time. Really seeing what your pain tolerance is and softening any tight tissue. Again, using your pelvic floor release breathing, envisioning the melting, the opening, the letting go, allowing yourself to move through the pain.